Hello, everyone. Today, we're going to learn how it's possible that Alzheimer's disease is actually preventable and even reversible.
People don't feel the heart attack that they're going to have tomorrow, but most people feel in their 40s, 50s, or 60s, they feel the memory changing, and it really worries them about what comes in the future. I don't mind getting older, but don't steal my brain.
And to hear that these things can be prevented and reversed, I think it's just instantly offering that, that.
Yeah, absolutely. I used to tiptoe around the subject because, most of us realize that when somebody gets the diagnosis of Alzheimer's disease, it's terminal disease. There is no treatment for it. Any of the treatments are just at slowing the progression. As far as normal aging, it is normal to lose some brain functioning over the course of time. There's different variations of it. We all have heard of those people in their 90s or even 100 Sharp's attack. Most of us aren't so fortunate to go that route, but a little is normal. But there is a pattern that if you hop on the curve, the train of Alzheimer's, that accelerates as time progresses. So the earlier we can catch it in the process, prevention's the best, but the earlier we can catch it in the process, the better chance they have at turning around before they've lost too many brain cells.
Who should actually be worried?
The people I target most for the preventative program are the people who, number one, have a family history of dementia. That's an important component. There are lots of genes that play into dementia, but there's one in particular that it's easy to check. I check it on all my patients. Again, it's called the ApoE gene, ApoE. And if you get your results and you're a 2, you can be really happy because a 2 is unusual, but it reduces your risk of dementia in your lifetime. A 3 is what most of us have, but 25% of the population is an ApoE4, 1 or 2 copies of a 4. That basically, if that happens, there's a 25% chance if you got 1 copy of the ApoE4, and a 50 up to 90% lifetime risk of Alzheimer's if you're about the 1 or 2% that have 2 copies of the 4.
Are there any other kind of common factors that play a part in people being diagnosed?
There are lots of contributors to Alzheimer's disease. That's what this program is all about. If people are not sure if they should be concerned or not, there is a tool I use in my practice called CNS, Central Nervous System Vital Signs, CNS Vital Signs. It's actually a pretty good cognitive test that people can just do that will help to kind of give them a deeper dive assessment. They do about 40 minutes of questions, and it kind of takes a look at their cognitive abilities. Typically, if somebody comes in with some memory concerns, then what we'll do is we'll order a few tests to make sure it's not their thyroid or B12 deficiency, a couple things like that. Even when somebody has Alzheimer's, the number of tests that the neurologists do are sadly limited. We'll make sure it's not other conditions like depression. Depression can mask itself. It's actually called pseudo dementia. You treat somebody for depression and their memory gets better. So that's one thing, especially if you have a parent or an older relative who seems to be having problems, make sure they get checked out. It could be that.
Wow.
And then if I have a suspicion that they're going down a bad path, I'll send them off to a neurologist just to make sure that I'm on the right path, and frankly, to get someone else besides me to break this news to the patient. Generally, traditional approach is to give people medication. There's 2 or 3 medications out there, others in the pipeline, but not terribly promising. But the medications, as I said before, they don't reverse anything. They don't stop anything. They just slow the progression. How we work the program is we gather all kinds of data from imaging to blood work, urine testing, saliva testing of the mouth, because oral bacteria issues could play into the disease. So we gather a bunch of information, lay out all the data on a spreadsheet, and that gives me an opportunity to take a look at it and figure out where is their problem. Dr. Bredesen in his books breaks down the contributors into 6 different categories. There is general inflammation. There's deficiencies of hormones and nutrients. 3 is toxicities. Cardiovascular disease is a big contributor to it. So that's why the heart attack and stroke program played into this one beautifully. And past trauma. So past trauma will set people on a path towards being at higher risk of dementia. And those are all actually just contributor categories. The one diagnosis on the list is diabetes and prediabetes. It's such a big contributor that it gets a category of its own in the process. So if anybody has diabetes or prediabetes, that they're already having a significant contributor to memory loss over the course of the next years or decades.